Hello everyone, my name is Keisha Brooks and this is my final PowerPoint project. The topic of my project focuses on communication malpractice. Communication malpractice is a health concern that needs urgent attention. Lack of proper communication skills may be a source of different problems in the health sector. In this presentation, parameters surrounding communication malpractice have been discussed. Communication is crucial in healthcare institutions, particularly in patient safety. Communication malpractice cites from the interaction between healthcare providers and the patients. Trust is the primary factor that ties all parties together. Every stakeholder is bound to develop and maintain trust in their communication process. For instance, the patient is responsible for giving all the information about their illness to the medical practitioner. The information is used to treat their illness, therefore the need for complete and clear disclosure. Additionally, the medical practitioner is bound to maintain a high level of trust in the patient's medical record. The records are meant to be private and confidential. To ensure no communication malpractice are present, the patient's consent to disclose their medical records to third parties is needed, including family members and friends. Most of the time, disclosing such private and confidential details may be required to make sound and comprehensive health decisions for the patients. Communication malpractice is likely to occur if the trust between these parties is violated in the process. It may be led to adverse effects such as medical errors. It is important to adhere to the set rules and communication guidelines in critical treatment procedures such as surgeries. This way, patient safety is guaranteed and communication malpractice is likely prevented. In a healthcare setting, communication drives day-to-day activities. Every stakeholder is entitled to communicate effectively with each other. When all parties adhere to communication rules and guidelines, it is impossible to experience communication malpractice. The patients should notify the nurses or doctors of the information regarding their health. The responsibility to provide empathy and a listening ear lies with the doctors. They listen to the patient's signs and symptoms before ruling out the problem. Moreover, nurses are the bridge between patient and family members. The nurses are responsible for communicating with the patient's relative on health decisions before taking actions, particularly in the cases of terminal diseases and during end-of-life situations. Besides that, the hospital admins are responsible for creating rules and guidelines for communication in healthcare institutions. The admins should present policies related to communication channels and protocols. The suppliers are obligated to communicate with all the departments and instructions on matters regarding suppliers' orders. Lack of proper communication by the suppliers may cause medical inconveniences to the patients. Every institution faces challenges which calls for developing a SWOT analysis tool to handle the problems particularly are in communication malpractices. SWOT analysis highlights the institution's strengths. The strengths are the pillars of the institution. The SWOT ensures that the hospital is in a position to maintain its strength. Factors that enhance hospital strength may include, but are not limited to, employee selection. The managers ensure that the task force is competent to provide quality patient services. Weaknesses are also part of the SWOT analysis. It helps the management determine issues to handle. Ensuring that the weaknesses are well taken care of puts the hospital in a better position to make more profits and improve health care. Issues of inadequate staff are a weakness in a healthcare institution and may cause work burnout and make shifting impossible. Additionally, SWOT analysis aids the management with determining the opportunities and jumping into them. This tool equips the hospital's management with the necessary knowledge to handle the opportunities. The presence of SWOT analysis ensures the opportunity to create appropriate communication protocol in the local hospital. Threats are also part of the SWOT analysis. Its inclusion in the tool ensures that the healthcare managers determine the threats in the system that could jeopardize patients' care. The risk of legal implications that could arise from communication malpractice is prevented. The SWOT analysis sites ensure that the management and other stakeholders approach the communication malpractice significantly. The stakeholders in a hospital's setting are meant to work towards the common goals set by the leaders. The stakeholders may include doctors, nurses, patients, suppliers, and hospital administrators, among other groups. Incorporating the leader member exchange theory is one of the most effective procedures to solve communication malpractice. This theory presents leaders and employees with a platform to freely share ideas. It also ensures that there is frequent communication between the two parties. This way, communication malpractice is prevented. Additionally, change is essential while dealing with communication malpractice in the hospital. Lewin's change management model ensures that the leaders work closely with employees to bring about change and communication protocols. Changes are communicated to the employees to ensure that every member on board is aware of the institution's direction. Lewin's change management theory is compatible with the leader-member exchange theory. This factor renders this change approach a very effective measure. Effective communication in healthcare carries the heaviest weight in health institutions. The interaction among stakeholders calls for adequate and sane communication strategies. The leadership in health institutions is obliged to set the standards and communication protocols between different stakeholders in the institution. Through leader-member exchange theory, the management ensures effective communication among the employees. This theory presents an opportunity for the staff and the leaders to coexist. Eventually, the employees' quality of service delivery is improved. However, subordinates vary in ways that they value the relationship between them and their bosses. Some present much value than others. The leaders should ensure to install leader-member exchange theory to establish communication between them and their employees. However, the communication relationship should not be forced into the employees if they do not find it important. The leaders should not force the same. The theory ensures frequent communication, making it easier for employees to express their ideas freely. The leaders can show trust and faith in the employees, which builds their courage to work towards the expectations. However, the application of transformative leadership is also crucial. This theory ensures that social systems and change work effectively. Applying the leader-member theory will require managers and employees to work in the spirit of teamwork. Communication malpractices have no chance of survival in the presence of a leader-member theory of leadership. Applying this theory ensures knowledge sharing between employees and the leaders. It improves the employees' creativity. 1. Role taking. The leaders are tasked to form groups where the employees join and own up to their responsibilities. The members will be assessed by their leaders regularly to determine their ability to perform duties. 2. Role making. This step requires that the members perform their duties. The leaders do orientation to ensure that there is the maximum yield from the members' duties. 3. Routinization. This step cites to create a healthy routine to maintain trust and respect among other values between the leaders and the members of the teams. Effective communication in an institution is very crucial. However, change may be necessary for specific situations. The 6 health domains, efficiency, safety, effectiveness, timeliness, accessibility, and patient-centeredness, have continued to demand attention to changes. To handle communication malpractices in health institutions, the leaders must approach change theory. Methodologies of change are meant to bring about slight or significant differences in the conduction of activities. When changes are made, the leaders must communicate the same to all the employees. This way, quality service delivery is guaranteed since every member is updated. However, executing a change theory that coexists with the leadership theory in place is essential. In the case of a hospital, Lewin's change management model works well with leader-member exchange theory, ensuring maximum productivity. Lewin's change management model defines how people react to changes, which is the first phase. The second phase ensures that the planned ideas are executed, while the third phase ensures that the employees take up the changes to be part of their daily operations. The management should evaluate the results of change in the institutions. Evaluation should be on results before and after the application of the change. The results should give the ultimate picture of the benefits of applying the change. The management should measure the benefits according to the employee's productivity with the proper communication procedures. Communication malpractices require adequate attention from all the stakeholders of health institutions. Identification of the problem is the most critical part of solving the same. The management should be keen to notice defects in communication. Additionally, the development of a SWOT analysis aids in solving communication malpractices. SWOT analysis helps analyze communication malpractices, strengths, weaknesses, opportunities, and threats. Analyzing and applying the appropriate leadership theory is another way of solving the challenge of communication malpractice. The leader-member exchange theory is credited as the best theory in health leadership. However, while choosing a leadership theory, it is essential to choose a change theory that complies with the same. In this case, Lewis' management theory works well with the leader-member exchange theory. This concludes my topic on communication malpractice.